Neck pain can be unrelenting and it can affect all aspects of our lives. But what I've seen in my 20 years of treating neck and upper back pain is that almost all neck pain has one underlying cause. When that one cause is understood and addressed, then people can usually get back to feeling good and get lasting results. What I'm going to do in this video is help you understand that underlying cause and then give you 4 simple exercises that you can do to start to address that cause. As we begin, I want to give you a classic example. This is a 41-year-old gentleman. He's got a desk job, and if you asked him all of his life since high school, he's carried his tension in his neck and shoulders. In the last year, his neck pain had affected him such that he was having acute, painful episodes with things like just waking up in the morning and he'd feel like he was getting stabbed in his neck. He couldn't rotate his head. To doing simple things like picking groceries up out of the back of the car. When he came into me, he said, "Doc, I just want to be able to pick my kids up and give them a hug without worrying that my neck's going to go out." Because he said those years are going quickly. The neck pain that he had would be tension. It'd start out as tension in his neck and upper back. Sometimes it would travel into that right shoulder, and occasionally in the last few months, it had traveled down into his arm, sometimes with sleeping. He also, towards the end of the day, would get a headache a lot of times with it, kind of a tension type headache. Before he came to see me, he went and saw his MD, and they'd taken x-rays. They'd said, "We don't see anything." They told him to ice, rest it, take anti-inflammatories. He did that for about a month. It wasn't getting better. So he went back to his MD. They gave him a script for physical therapy. He did 6 weeks of physical therapy. And while he was doing the exercises, he felt some improvement. But when he stopped, it seemed like it came right back. Before he came and saw me, he'd saw 2 other chiropractors. And both of those chiropractors had him doing at least 3 times a week of visits. And when he would get adjusted, his neck would feel better for a few hours or a day, but then his pain would be right back. And so he wondered, am I just going to have to do physical therapy exercises for the rest of my life, or get adjusted, or take anti-inflammatories? He was really getting depressed about how could he be 41, not have had an injury, and feel like this was going to be his lot in life. When he came to see me, I helped him understand, and I could see immediately upon seeing him, that he had that underlying cause of his neck pain. No one had ever taught him, all those providers that he'd seen, no one had ever taught him these principles. So I taught him those principles. I taught how that affects his neck and what he can do about it. I taught him some simple exercises, and because his case had been there for so long, we had to get him back up on his feet. That took 6 visits over 4 weeks. In those 6 visits, we were able to clean up the things that had been there, and at the end of those 4 weeks, he was able to be back in the gym, pick up his kids without worrying that his neck was going to go out, sleep through the night without getting numbness in his arm. That's what I'm going to share with you here. What we did for him, the exercises that we taught him, and how we approached his case to help him get back on his feet and out of pain. Before we begin, it's important to know that this one-way medium of YouTube, which is amazing, is not a way to get diagnosed. So please don't self-diagnose. Make sure that you're working with a doc. There can be many different causes of neck pain, so it's important to understand that cause. And then secondly, before you begin any new program or exercises, make sure that you check in with your doc. So what is the underlying cause of neck pain that just feels like it won't resolve, that you feel like you're never going to be able to get rid of? There's 2 elements to the cause, and I'm going to help you understand those now. First, let's talk a little anatomy. This is the spine here. This is the base of the skull and the pelvis down here. You have 24 vertebrae in your neck. This is called your cervical vertebra. In between them are cervical discs. These yellow things that come out, those are your cervical nerves, your cervical spinal nerves. Those nerves in your neck, they go to give all the sensation and control of your muscles to your arms. Below that, we have the thoracic spine. It's made up of 12 vertebrae. An important thing to note here is that most of the time, people from bad posture, things like that, end up with a rounding in their upper back. And that rounding in the upper back, some people call it a dowager's hump. When we get that, important thing is the foundation of the neck of your cervical spine is this thoracic spine. And most people, when they go to address a neck pain issue, what they'll do is they'll try to improve their posture and work on correcting the stuff in their neck. But if they don't address this foundation, this thoracic spine, which is, if it's rounded like this, it's shooting their neck, the foundation shooting their neck this way. If they just go and address the neck this way, what we do is actually create a pinching down on the nerves in the neck, make more tightness in the back of the neck, and actually we can start to get symptoms going down the arm. We can start to feel like our head feels really heavy, like we just can't win. And so the issue, the first thing I want you to understand is that a lot of times neck pain issues, we have to start at the foundation. We have to address it as an upper back issue as well as a neck issue. If we do that and we start to work on that upper back and on the neck, then we can get a spine that is stacked the way it should be and that leaves proper openings for the nerves and also takes the weight of the head, and the head weighs a significant amount, about 8 to 9 pounds in people. The weight of the head is borne by these building blocks, which are the vertebrae themselves, instead of being borne when our spine is like this. Look at that, the head fell down. Instead of being borne by the muscles that are back here, that are keeping the head from just falling over. The first key I want you to understand is that when people have a neck pain issue, if we are not looking and addressing the upper back first, it's really hard for us to ever get a win in the neck itself. And that can be really frustrating. The second part of the underlying cause of most neck and upper back pain has to do with the idea that most people, whether that's the person with the pain or the provider, doctor, therapist that's trying to help them, address the thing that is screaming, that's hurting. In neck and upper back pain, that is almost always this upper trapezius region here, levator scapula, upper trapezius. That is tight, it's achy, it's burning, feels like it wants a massage. And so people use a hypervolt instrument, they get a massage, they get acupuncture there, they get chiropractic adjustments, neck stretches like this. They address that tight muscle. And the thing is that muscles work as synergists and antagonists to each other. They work to stabilize joints, and they don't work in isolation. If you take nothing else away from this video, that principle is what drives my practice and gets lasting results for people, is that we don't just go after the thing that is screaming, but we go after the thing that's making the thing scream. I'm going to help you understand that in something that's in this book. This book is Clinical Applications of Neuromuscular Technique. This is volume 1, The Upper Body. Leon Chaital and Judith Walker Delaney, an amazing book for manual therapists. And in this book, it talks about this here, which is called upper crossed syndrome. It's a postural syndrome. And when they say crossed, what they're talking about is this kind of X, this cross here. And what that means is that there is tight upper trapezius, tightness here in the upper back and neck, but there's also tightness here in the pectoralis region. Additionally, there is weakness in the neck and in the upper back. And let me talk through that in a second. We live in a flexor dominant society. What that means is everything we're doing is here. We drive our cars, we type, we text, we cook. Everything we do is here. So what happens is our backs get weak and our fronts, our pectoralis muscles mainly, get tight and short. I joke with my patients that if they were coming to a visit 125 years ago, they would have been riding a horse and they would have been pulling back on the reins, which would have opened up their chest and strengthened their back. They might also have been heating their house by chopping wood for the stove, which would have strengthened their back. They probably would have had a job where they would have pushed and pulled things, strengthening their back. We don't do anything these days, short of going to the gym for a little bit if you do that, to strengthen our back. And we do tons of stuff that shortens us here. That's why as people age, they end up here, like this. If you don't want to end up like this, which doesn't look good, but it's also painful, what we're going to teach in this video is critically important to you. Yes, these muscles are tight up here, these upper trapezius, levator scap, but you're also tight in this crossed pattern of the pectoralis muscle, major and minor. And so we're going to teach you how to address that. And those weaknesses of the deep neck flexors, as people's heads go out this way and they get that forward head posture. It's the muscles deep in the neck that help to pull the head back like this. And when you can try this at home, put your head out far and feel how tight these muscles get up here. As you bring your chin back, the weight of your head gets borne in the bones, and see how soft those muscles get. So it's impossible for us to get these muscles to calm down if our head's out like this. So we're going to teach you how to strengthen those deep neck flexors. And lastly, the muscles here on the back of the body that help to stabilize our shoulder blades, but also take and pull them back and down. They are vitally important to getting these to calm down. So we're going to teach you how to strengthen in a really simple exercise those muscles that pull the shoulders back and down. So when we look at those underlying causes of neck pain and we address those, and I'm going to show you how to do that and how we do that in the office, that's when we can get lasting results. 9 out of 10 patients that come into my office, they have never heard these concepts that I'm teaching you right now. And if these concepts were known by more people, I don't think neck pain would be one of the leading causes of disability in our country and in the world. So let's get to how we can fix it. So what can we do about upper cross syndrome? I'm going to teach you 4 exercises that you can do at home. The equipment that I love to use, I'm going to take and put links down below in the show notes. But that being said, I'm going to give you ideas for alternatives that you can use in your home. The most important thing is just get in and do the exercises. The cool thing about these exercises is that of all the thousands of patients that I've taught them to, patients come back and they love these exercises because they notice a change when they do these. A lot of times we'll do exercises and we go, I don't know if that's really helping me out. I don't know if I feel different. If you do these exercises and they seem appropriate for you, you should feel different with doing them. And that's pretty awesome. Okay, let's get started. Exercise number 1 is called using a trigger point ball at our pectoralis muscles. We're going to use that to work out trigger points and to get more flexibility and opening and space in our chest. I like to use a trigger point ball. You can use a tennis type ball. This is a solid wooden ball. You can also use a lacrosse ball, a softball. But I'm going to show it to you with a trigger point ball. Trigger point ball is hard on the inside so that if this is our tissues, that the tissues wrap around the ball instead of the ball collapsing underneath our tissues. That'd be the only lack of using like a tennis ball, but sometimes people starting out with a tennis ball, that might be more comfortable. What we're going to do is take the ball with 2 hands and work along in our pectoralis muscles. Just know that when you first start doing this, it might be incredibly tender in this area. When I first did this, I couldn't believe how painful it was, even what I've just done so far. And the reason is no one ever pays attention to their pectoralis muscles. Even if you go and get a massage, people don't really work on them. So what we're going to do, your pectoralis muscle runs underneath your clavicle, down your sternum to about here, and to the front of your shoulder. You're going to work that whole area. There is what feels like a ropey structure that runs this way. It might feel like almost like a number 2 pencil under there that runs down like this. Might be a little tender. That's your biceps tendon. Hang out. Don't roll over the top of that with the ball. But everywhere else is fair game. If you roll over your biceps tendon, it might get irritated. It will get irritated. We're going to take and roll all around both sides of the pectoralis muscle. Where I start people with this is doing it 1 minute a day on each side. I'll have people work up from there. And this is an exercise that if people end up with this trigger point ball on their desk and when they're reading emails, maybe watching YouTube videos, and they do this, really notice big changes and add it into their daily routine at multiple times, they'll really get flexibility there in the chest. We're using this to open the chest up and get more, it will help our posture, but also is really going to help with your neck pain. That's step 1. Step 2 is taking the trigger point ball, coming up against a wall and taking kind of at an angle, maybe a 30-degree angle here. I'm going to bend my knees and I'm going to roll around and find a spot that feels like a trigger point. I'll feel like it might refer somewhere, Feels like localized tenderness there, and I'm just gonna hang out. What I'm doing is creating a localized stretch of those tissues around the ball, and I might hang out there for 30 seconds or 45 seconds, just getting a stretch. If you're someone that likes to get extra credit, I'm gonna show you one extra thing you can do. The extra thing is you can come here against the wall. We find a spot that feels like a trigger point, and what I'm gonna do is hold it there and bring my arm up. And in doing that, I get a pin of the tissues and stretch. So I'm getting a pin and stretch of those tissues. I'll get an even deeper effect. I don't usually have anyone work against the wall until they've done this with their hands for about a week or two. Then they can move to doing it with the wall. But you'll still get a benefit just from doing it this way. Exercise number 2 utilizes what's called CLX band. And I usually start people off with a red band. It's got these loops in it so that I don't have to hold it. If you have bands that you need to hold, that's fine. If you don't have a band and you just want to use a belt or a towel, that's going to be an isometric hold, but that will also be fine. Just do this exercise. This exercise is called Brugger's exercise. And what it does is fire all of your extensor muscles all at once in your upper extremities. It is an amazing reset for a life that is flexor dominant. So what we're going to do is put our fingers, except our thumbs, through the band. We're going to take and extend our fingers out all day long. We're turning our fingers into little claws, so it feels amazing to extend our fingers. We're going to extend our wrists. We're going to extend our elbows. And then we're going to take and extend our arms back like that, and then come back here. As we do that, we're going to externally rotate our palms. So our palms are turning out, facing away from us. We are not only flexor dominant, we are internally rotated. So people end up being like this. There's very few people that are just open up. I'm ready for the world. Are you ready for the world? We're going to take and extend our fingers, extend our wrists, extend our elbows, and then extend our arms back. As we do that, we don't want to let our shoulder blades come up. And we also don't want to involve our neck in this, where we stick our neck forward. Our neck should not be a part of this exercise. The last thing is that you want to take and bring your shoulder blades back together. You should be back in this position. It should be like you could squeeze a piece of paper between your shoulder blades. And then we're going to slowly come back. I like to start people with doing 3 sets of 12 of these. This is another one. If a person has this piece of CLX band on their desk with their trigger point ball, and they take a few breaks during the day to do this Brugger's exercise, after they finish it, just kind of roll your shoulders back. Everything just sets differently. You feel all of the muscles on your back, your triceps, the back of your arm. Everything feels like it's been woken up. Those are the things that almost never get used, and it actually feels fantastic to have those parts of the body turned back on. And after someone's gotten where they feel pretty good with the red band, then we can progress them to a green, a blue, kind of work our way up. Exercise number 3 is static thoracic spine extensions over a foam roller or something that's round like that. That being said, it's my favorite exercise, but when I first started doing it, I just felt like I could never get that motion back in my spine. Now, every time I get to do it, I love it. So I'm excited to show it to you. The idea behind it is people will use foam rollers to roll out things, their iliotibial bands, their quads, their back. And that rolling motion, it has its benefit to work out tight muscles and mobilize the tissues. But we talked about there being a rounding in the upper back and that throwing off the neck. What we're going to use the foam roller for is a fulcrum. Sometimes people will go to a yoga class and do something like a cobra pose, like this. That's a good way to get extension in the spine, but where your joints are moving, they'll move. And where they're stuck, there's the likelihood that they will stay stuck. What's great about this exercise is that it gets in and allows us to pinpoint each individual joint and help it go into extension. So here, if this joint, let's say we're going to start about T6 area is stuck, we're going to take and allow that slowly to extend over the foam roller over about 20 seconds or so. Then we're going to scoot our body down and slowly allow that joint to open up in the front, go into extension. And then we're going to do that in 4 or 5 locations. What happens after doing that in those locations is that that rounding that's in the back, the upper back, that dowager's hump, we can start to work on getting that to open up. And this exercise, unless you had the yoga instructor put their knee in your back and make that be your fulcrum, we just can't get this type of release. Maybe when we go and get a chiropractic adjustment, we can get something similar to that. But this is something that you can do on a regular basis in your home. So let me show you how I do it. I'm going to lie on my back. My knees are going to be up. My buttocks are on the floor. I'm going to start with the foam roller about where like a bra strap might be, around the area of T6. I do not need to go below that thoracic 6 level. What I'm going to do is put my hands underneath the lower part of my neck. I'm not interlacing my fingers, and I'm definitely not pulling my head forward this way. I'm just supporting my neck like this. If I keep my elbows kind of together, my bones will hold my head up instead of going here where I have to use my muscles. And then what I'm going to do is, keeping my ribs down, I'm going to take and slowly extend just at that T6 level over the foam roller. I'm going to breathe and slowly let my breath out and try and get more and more opening and space there. I'm going to hold that for about 20 seconds. After I do that, I'm going to come up. I'm going to slide down a little bit to the next level and then slowly relax over the back of it. If I'm doing this right, I might hear a pop or a release in there, but I will let you know when I first started doing this, it felt like I was getting stabbed in my back. It felt like I couldn't take a breath. And that's just because I hadn't moved into extension in my upper back for decades. Maybe since I was on the playground in elementary school. You can slowly get it back. What I would say, if this is too painful to start in, I would look up something called static back exercise by Egoscue, the Egoscue method. And that's an excellent thing that I take people through static back, and then I'll take them to this if this is too aggressive to start out with. Where we would finally end up after about 4 or 5 locations is in this area right here. And the more you do this and the more you get where you can relax over the top of it, you're going to feel things release and pop, and it just feels fantastic. About 20 seconds in each location. It should take you about 1.5 minutes to finish going through it with a foam roller. I love these foam rollers because of the polycarbonate, plastic inside. They just don't break down over time. But any foam roller, it doesn't have to be long, and it doesn't matter how hard or soft it is. What you're really looking for is just getting a radius. The last exercise I'm going to show you is to strengthen those deep neck flexor muscles. Those muscles that help to pull your chin back like this instead of it being out here. I want to begin by saying that this exercise, if it seems too aggressive, this is where you start. You'll take your chin and just practice doing chin retractions this way. I had a patient that had chronic neck pain, and this was too much what I'm about to show you. And I taught her just to do these. In her car, I taught her to try to find her headrest and then come back. What's important in this motion is that my eyes and ears stay level. We don't want to do this. We want to do this motion, like this. Some people say creating a double chin. I don't usually say that, but pulling back like this. In teaching her that exercise over a couple weeks, she said, now I have awareness of how far forward my chin was, and that gave her so much relaxation of the muscles up here without doing anything else, just because she had an awareness of putting her head, resting the weight of her head on top of her spine instead of having her head always out forward like this. But this exercise is called deep neck flexor strengthening. We do it lying on our back. You can put your knees up if you want. And what we're going to do is from here, the first step is to lengthen our neck while it's still on the floor. So most people are here. We're going to lengthen our neck. Then after that, we're going to take and slowly bring our chin up. As we do that, we're keeping our chin tucked in. And then we're going to slowly bring our head back this way and then relax.
So first step, lengthen my neck. Next step, keeping my chin in, come up, looking down towards my knees or feet. And then the next step is slowly coming back down, keeping my chin in. Once I'm here, I can relax. The opposite of that would be to do this, where I jutted my chin forward. We don't want to do that. We're going to keep our chin in, slowly come back down, and then relax. If I'm doing it right, I'm going to feel a lengthening of the muscles back here, a stretch in the back of my neck, and these muscles on the front of my neck are going to feel like they're getting a workout. You should be able to hold your neck up like this for 30 seconds, 45 seconds, a minute without it shaking. That is showing that your deep neck flexor muscles are strong. But a lot of times when people do this exercise, they'll be like ratchety on their way down. That's an indication that those muscles are weak in you and that this exercise is really going to help you to find a more neutral position for your neck. What I'd like to share with you now is how we address neck and upper back pain, sometimes pain that goes into the arm when it has been there for a long time, when it is a stubborn case, when someone might have been given the diagnosis of a degenerative disc disease in their neck or a cervical radiculopathy, osteoarthritis of the neck, spondylosis, and it's been there for a long time. Those can be more difficult cases, and they sometimes need us to do things to get the person back on their feet. Once we do that, they can usually go off knowing the things that they do, having things corrected, and feel fantastic. But what's important is that if you have been dealing with neck pain for a long time, months or years, and you've tried so many things, it can start to feel, and this is with any condition. I was a professional athlete, so my God, I got hurt so much. And I'd have these times where I'd feel like, am I ever gonna get back to not having pain? That can be really debilitating. It can be depressing. It can make us sad. Sometimes it makes us angry that we can't figure it out. And I just want you to know, don't give up. My goal for this part of the video is that you will understand that there is a lot of different ways to approach these things. And I think sometimes patients don't even know what they don't know. They go to their doctor, they assume that their doctor knows everything. I've been in practice 20 years. When I'm in practice 50 years, there'll still be tons I don't know. It's great that there's a lot of different providers that we can go to and learn from and gather their skills. But I want to give you an idea of how I approach it in a comprehensive way when someone comes in with neck pain, so that when you see your provider, you can maybe talk to them about these things, but also that you'll have an idea, if you're not getting some of these elements of care, that these things exist and you can try and find those in your community. I happen to be in Northern California in the San Francisco Bay Area, but there are people that do this type of work all around the world. Don't give up. Ask family and friends. Look on the internet. If you happen to be in the San Francisco Bay Area, I'd love to meet you and help you out, but don't give up. Keep working, keep finding someone. Okay, so here's how we approach a recalcitrant, tough case of neck pain. One of the first things we do when a patient comes in with this is we look at their posture. We take some specific pictures of their posture with their eyes closed so they don't have their visual writing reflexes changing anything. And we look to see, do they have upper cross syndrome? How badly do they have it? And we share those pictures with the patient. In sharing them with the patient gets an external recognition of where their body is in space, and then we help them to learn how to correct their posture. It is a process, it's not impossible, and it is fundamental to getting someone better if their posture is really off. We have to address that. It is not about stand up straight and pull your chin in, stuff like that. If that was all that it took to have great posture, we'd all have fabulous posture. But it's one of my passions. I've traveled around the world to learn from experts about how to help people get back to an amazing posture. Second, we look at their ergonomics. If the things that you are doing in your everyday life, if you work at a desk, if you knit or you craft, do woodworking, things that would have you hunched over something, we need to pay attention to that and make sure that you can win at whatever you're doing. If you watch a lot of TV at night, if you game on a computer station, if you are a student on a laptop, we need to make sure that you can win in those situations so that we aren't fixing you
and then you go right back to breaking yourself. I cannot create a lasting change in someone if they're doing something destructive to their body over and over and over. That being said, there's easy solutions. So we have patients, our patients, take pictures of themselves doing things that we ask for specific pictures in different angles. And then we take and mark those pictures up, go through them with the patient, and give them easy solutions that they can do to improve the ergonomics and make it so they can win at their workstation and win at school and win at the things that they love to do. The next thing we do is address the muscles. And there's 3 things that can happen to muscles. People know that muscles can get tight and they need to be stretched. And we talked about how sometimes the muscles that appear to need to be stretched, really what we need to do is address the muscles that are paired with them, synergists and antagonists, and maybe strengthen them, maybe stretch them. So muscles can need to be stretched, and we teach them if they have tight muscles to stretch those. It's actually the least of what we do. Sometimes muscles, specific muscles, need to be strengthened. And it's important to address the specific muscles. What really frustrates me is when someone goes to a doc and they give them some photocopied or now they're printed off sheet of exercises that they give to everyone that has neck pain. The thing is that you are a unique individual and your neck pain has come on from your lifestyle, from injuries you've had, and you need to be addressed for your specific weaknesses. Where we get frustrated is someone is given 12 exercises or 15 exercises to do when they could do 3 or 4 and get the same benefit. So we test their muscles and then give them specific exercises to strengthen if they have a functional deficit. And then the next thing that we do, and this is often not looked at, but I will go in and test all of the muscles around someone's shoulder girdle, but also around their neck. The one that we classically find is this sternocleidomastoid muscle here. You can see it popping off my neck. It's a really important stabilizer for the front of the neck. And that muscle, it's like the breaker can get tripped. So it's not that it needs to be worked out. It's that it needs to have the breaker turned back on. How does the breaker get tripped? Usually from an accident. So a car accident, a fall off a horse, a fall snowboarding or water skiing. I had a soccer player that someone kicked the ball and the ball came and hit them at a close range really hard. That took and turned that muscle off. The cool thing is we test the muscle, and then after we test it with some really simple stuff that we can do in the office in usually a single visit, we can get that muscle turned back on and it stays turned on. If we don't address that sternocleidomastoid muscle, and sometimes it's other muscles, but this one is classic, then these other muscles in the neck are going to stay tight because they're making up for the fact that one of these muscles isn't firing right. So we address functionally inhibited muscles like the sternocleidomastoid in chronic cases. Another thing that's really important is the myofascia. Fascia is the covering on top of everything in your body. On top of your muscles, it's called myofascia. And where you've seen fascia is on a raw chicken breast. It's that shiny, slippery coating that's on a raw chicken breast. If you took 2 wet, raw chicken breasts, they're super slippery on each other. The 650 muscles in your body are all covered in fascia so that they can be super slippery against each other. But from trauma, repetitive motion injuries, and postural stresses, we can get where those fascia layers get stuck together, almost like scar tissue between those. And that leads to a whole host of problems. Tissues that feel chronically stiff and stuck, active trigger points that cause referral pain. It's bad stuff. The cool thing is that we can get in with a tool like this. This is called a Graston tool, and work on those tissues to break up those adhesions. We usually only have to do 1, 2, at the max 3 sessions in a specific area to clean up those adhesions and get those tissues moving properly again. This style of treatment works on the fascia. It's called Instrument-Assisted Soft Tissue Mobilization, or IASTM. So you can look up, I'll put some links down below in the show notes of different organizations, and you can look for the provider directories there of people that do Graston. And there's another way that we look and address fascial problems. That's called Fascial Distortion Model, or FDM. And in FDM, we look at fascia as 6 different things that can happen with fascia. And each one of those, whether they're trigger bands or herniated trigger points, they're all treated in a different way. If you have not had someone address your pain and you've had chronic pain and you haven't had someone look at your fascia and really work deep into that, it is really a good idea to have someone do that. And I am a sports chiropractor, and adjusting joints is part of what I do. Getting motion back in joints. But I want to say a few things on that. Sometimes we have instability in joints, and getting them adjusted is contraindicated or not going to help the person. In some cases, it might cause them to have more pain in their neck. There are ways to assess if someone has instability. From my extreme sports career, I have instability in my neck, and so I can't get manual adjustments at my neck. It just flares it and makes it feel worse. There are ways that I can get adjusted. That includes using this. This is called an Activator instrument that does a little impulse like this. Doesn't involve any rotation, doesn't involve any popping. It's a very low force technique chiropractically, but if I have joints that are stuck and not moving, I can still get this type of adjustment in my neck and get good relief. If you're afraid of getting adjusted because of a manual adjustment and cracking in your neck and things like that, this is an excellent thing. Don't let your fear of a manual adjustment keep you away from seeing a chiropractor. Understand that there are chiropractors that do instrument adjusting. There are ways to assess if someone has instability in the neck. That is by taking not just x-rays where you're standing there, but we take what are called flexion extension x-ray. So we'd have someone bend their neck as far as they could down and then take an x-ray and then lean their head back as far as they can and take another x-ray. And we look to see, is there slippage of the vertebra that should be held together by our ligamentous tissue. In my case, those vertebrae slip because there's dynamic instability. That dynamic instability over time, if not addressed, leads to someone needing a disc replacement or a fusion in their neck. I was young and took some bad falls, and so I have that, but I'm doing everything I can to maintain my posture, the strength of my neck muscles, treat the joints well, so that hopefully I can either put off or completely avoid in my life having to have a fusion or a disc replacement, even though I've had significant trauma to my neck. If you found this video helpful, I hope that you'll give it a thumbs up and that you'll also subscribe to our channel. I'm always trying to put out content that will help you understand your body better and how to keep it moving and feeling amazing. We'd love it if you'd share a comment down below. If you've had an experience with neck pain, if you found something that's worked good for you, or you just have a question, we love the dialogue around these issues. Until next time, take care.